I help physicians by helping them understand the literature, bringing them information, looking up information for them. There's lots of questions from them on everything from drug-drug interactions to adverse effects to primary literature, just understanding appropriate use of medications, treatment guidelines. So I help physicians by making sure that they get all that correct information.
The education and services that CPNP provides can benefit a variety of other professionals. Medications particularly, and their impact on mental illness, are of tremendous interest to everybody who works in that field. People like nurse practitioners, psychiatrists, nurses, and even ancillary therapists and social workers, psychologists, are tremendously involved with the medication therapy and assessing the results of medication therapy for people with mental illness. Those people would tremendously benefit from the kinds of educational programs that CPNP has to offer.
CPNP and NAMI enjoy a very close relationship with each other and have for a number of years. We provide resources on the NAMI website, including the Ask the Psychiatric Pharmacist question and answer section, and we also provide medication information sheets for patients. In addition, we provide educational programming at the NAMI annual meeting on a very regular basis. And in addition, we act as a resource for NAMI for their needs in psychiatric pharmacy questions.
As the chair of the legislative committee, the role of our committee is to work with the healthcare reform stakeholders group, and we've been very active part of that group in trying to get the healthcare reform implemented. Sometimes it seems like changes are happening at a snail's pace, but I think there really is opportunity not only as an organization and as a committee, but as individuals to interact with our members of Congress, and not only at the national level but at the local and state level, that we need to reach out to those folks and let them know who we are and what we do and how we can help them in providing better care for their constituents and saving money for the states and on a national level.
Just yesterday, I had a medication education group, and the students were leading the medication group, but there was a patient there that had been there for about 6 weeks, and she's actually come a long way. She was very resistant to treatment. She refused treatment. We had to get legal authorization to treat her, and finally in medication group she was asking, what are my Depakote levels? How can I get these expensive medications when I leave? What kind of assistance will I have? And I feel like through introducing her to the medications, talking to her in the beginning, and having her in my group over time, that she's really opened up and developed some insight about her illness.
I think the thing I would tell the public is that as a pharmacist, my focus is really educating patients, educating them on how to use medications correctly, and educating patients about their underlying disease state. And I think those are the things that sometimes are overlooked when patients are diagnosed, or especially if they're newly diagnosed, and things that they don't understand are the place of medication therapy in their overall treatment.